Good day everyone, welcome back to my channel. Today we're talking about vaginal discharge, when it's normal and when it's abnormal. First, let's know the meaning of vaginal discharge. Now, these are normal bodily fluids which helps to keep the vagina healthy and protect it from infections. Now, it's normal and a healthy sign for vagina to actually have discharge daily, but it can change due to menstrual cycle, pregnancy or hormonal birth control. Now, a normal discharge is often clear, milky, white or off-white and may have a slight odor or no odor at all. Now, as a woman, you can be having discharge that are white and clear, but as long as it doesn't have any odor, you know that your vaginal discharge is normal. Now, if you notice a foul smell, green or grey color, foamy texture, or you are experiencing symptoms like itching, burning or pain, it could indicate an infection or other health issue, so you should see a doctor. Now, when you're having other kinds of discharge colors like green, gray or deep yellow, it's best to contact a doctor because it might actually mean something else. Now, this is when discharge is now abnormal. When you're having other colors and your discharge is like a little bit of thick or foamy texture, it's best to contact a doctor. So now let's talk about what a normal discharge looks and feels like. First of all, the color. A normal discharge has a white color, clear color or off-white color. Though sometimes it can look yellowish when it dries on your underwear, but normally it should be off-white, clear or white in color. When we talk about the texture, it can vary from thin and sticky to thick and gooey. So discharge should have a thick or thin texture. When we talk about the odor, it has a slight odor or no odor at all. So when you're having a foul smell or a fishy smell from your discharge, it means there's something wrong. Now, the amount of a normal discharge should be at least 1 teaspoon or 5 milliliters daily. So your discharge should not be too much and it should not be too small. When you're noticing that you have like lots of discharge, it means something else. It can be abnormal or it can be a sign of an infection. Now let's talk about what an abnormal discharge looks and feels like. So now, when a discharge is an abnormal, the color can be green, gray, dark yellow or brown. So when you have these colors of discharge, it means that your discharge is not normal. Then smell, it should have a foul or fishy odor. When you're having a foul odor from your discharge, it means a sign of infection or something more serious. When there is a foamy or chunky texture, discharge is not normal. Then when there are accompanying symptoms like vaginal itching, redness, burning, swelling, pain with intercourse or pelvic pain, it can be a sign of infection or something different. So when you're having these features in your discharge, best see a doctor for further clarification. Now let's talk about what can affect vaginal discharge. First on our list, we have menstrual changes. Now, your menstrual cycle causes variation in discharge, its consistency and color throughout the cycle. Your hormonal changes can cause variations in your discharge. Second on our list, we have pregnancy. Hormonal changes during pregnancy can increase discharge and also change its texture and color. Hormonal birth control pills, like some birth control pills, can change your discharge and make it consistently thick, white and sticky. We also have infections. Bacterial infections, yeast infections and sexually transmitted infections can all change your vaginal discharge. Like we stated earlier, some colors can detect infections, some textures and odor can actually detect infections. Now in details, let's talk about colors of discharge and what they can actually mean. First, clear color. It can mean a healthy discharge, it can mean pregnancy, it's a sign of ovulation and hormonal imbalance. So when you're having a clear discharge, this can mean these things. It can mean a healthy discharge, pregnancy, ovulation or hormonal imbalance. Second on the list, we have white. White discharge can also detect yeast infections and can also mean a healthy discharge. So when you're having this kind of discharge, it depends if there are accompanying symptoms like itching or burning to know if it's healthy or if it's actually a yeast infection. Third on our list, we have gray. A gray color discharge can mean bacterial vaginosis. This can mean a bacterial infection. So you need to check further to know if it's actually an infection. We have yellow-green. The yellow-green color of discharge can detect STI, which is sexually transmitted disease. We have pink color. When you're having a pink color discharge, this can mean a cervical bleeding, vaginal irritation, or implantation bleeding. So when you're having this color of discharge, you need to know further what it actually means. Then we also have red. When you're having red discharge from your vagina, it can mean menstruation, cervical infection, cervical polyp, endometrial or cervical cancer. So these colors, when you're having this color of discharge, it's better for you to check further to know exactly what it actually means, and if there are accompanying symptoms, you should try your best to tackle it and treat yourself so you'll be free from infections. So finally, it's normal for a woman to have discharge every day. Yes, it's normal for a woman to have discharge every day, and it should be a small amount of discharge, as long as you're not having some accompanying symptoms like itching, burning, and your discharge is clear in color. It's normal for you to have discharge every day. So when you notice changes in your discharge, or if you notice some symptoms like burning, itching, redness of the vagina, it's best for you to see your doctor or your health professional for further clarification. So please, thank you for watching. Please don't forget to like, comment, and subscribe to my channel, and please share this video to someone you know that needs to learn from this. Thank you.